basic overview of the agenda. We're going to be talking about some preliminary issues, talk about the work plan itself, and go through the preparation for beginning the self-study process phase, where to get started, talk about the process itself, and then in the end, to the extent that we have time, I'll go into more or less detail about managing the actual work of undergoing the self-study. Okay. I'm speaking to you as if it is your job to get your organization accredited. Basically, I'm speaking to you as if you are your organization's primary contact, right? I'm sure most of you know what that means. So the decision's been made. You are your organization's primary contact, whether you volunteered for it, whether you were selected, or maybe you were even hired specifically for this job. So now what? Couple of quick early messages. This is a very doable process, okay? Many organizations of all sizes and service types have managed this process successfully and become accredited. We have agencies with as few as 10 staff, and we have agencies as large as thousands of staff. Some of our big public agencies can have 10,000 staff statewide. They've also managed the process. So wherever you're starting from, this is a doable process. Also, I want you to understand that you're not alone, okay? You have on COA's end, you'll have a coordinator who you'll be assigned to work with one-on-one. And behind him or her is any number of staff to help answer questions and provide technical assistance if necessary. So you're not alone in this process. If you have questions, ask, okay? Next, don't delay, okay? As soon as you know you're going to start this process, and as soon as you sign a financial agreement, whatever those early steps, wherever you are, start getting ready, okay? There's a lot to work on, and we'll go into that as we go over through the next several the next 2 hours. And there's no substitute for being organized, and that's really what the primary theme is today, is getting yourself organized and being prepared to really manage this process. Carrie, I sent copies, PDF versions of the slides to everybody. So check your email. I sent it about 25 after 2, so they should be there. And if not, I can get them to you afterward. So this is doable, right? However, you have to keep in mind that this is not an easy process. And it's not supposed to be easy. It is designed to challenge your organization to work and function at a higher level. It's going to challenge every part of your organization as you go through this process. If you've already begun to look at the standards, you'll know that we cover all aspects of management and operations, and in great detail, all aspects of how services are delivered. So, right up front, you need to be realistic about not just about the amount of work that's going to be involved, but what resources are available to you, how many staff are going to be available to you, how available will the board be, senior management. I don't know where you are in the hierarchy of, in the org chart of your organization. Some of you are probably very senior in your organization. Some of you are not going to be. And you need to begin to get a handle on what resources are going to be available to you. Keeping in mind also that this ideally is going to be a team effort, okay? You and the rest of your organization's staff are going to be working together to get accredited. And the big work of getting accredited, and actually most of the work, is during the self-study phase, which is, if you've just started this process, or if you're already in it, you already have a good sense of that. Now here's a summary, little, and I typically don't like to just read off of slides, but I'll do it this time. There are a lot of standards to review. Your accreditation is on a strict timeline. So staying on top of the work and not letting it get away from you is critical. Okay, someone asked me to summarize this training once in a sentence, and this is the sentence I created. So keep that in mind. It's really important, vital, I would say, from the outset that you understand COA's accreditation process. Okay? The best place to start with that is reading the accreditation guidelines. I'll talk about the guidelines in more detail in a little bit. You want to understand the due dates, the milestones. You want to understand decision-making, who makes the decisions about whether you're accredited or not. What exactly is the role of the peer reviewers who are going to come on site? What are they going to do when they get here? How exactly do they rate the standards? How is that done? How are we going to be evaluated? And also, try to familiarize yourself with what resources, training and technical assistance resources are available to you. Okay, and we'll talk a little bit about that coming up also. Okay, obviously you all found your way to being able to sign up for this webinar. So keep back and keep looking at that page. What I'm going to do is there will be a follow-up email to this training, and in it I will include a list of the upcoming webinars. And for those of you who are interested, the 3-part PQI series has been scheduled now, and that will start on February 19th and go for 3 consecutive weeks. So if you're interested in that, if you want to sign up, it's usually pretty popular. We've reduced the price from $200 for all 3 to $75. So anyway, this is a quick blurb on that. You want to try to sign up for that before it fills. Okay, so here's another quick yes or no question. Do you know where to find the accreditation guidelines? Okay, we have about a third of you have responded, and a couple of no's. Now we've got about a third no's. I'm assuming that the no's are folks who have not gotten too deeply into the process yet. Let me show you very quickly where they are. And the thing is, this is going to vary a little bit. But in every case, there's a page where you can go on the standards website. So let me open up the website quickly, and I'll show you where they are. The way to find them, the best way to find them, is to open up the website, go to the standards drop-down menu, click on whatever standards apply to you, whether it's standards for private or public or Canadian organizations. Go over to the left, look and scroll down just below the blue rectangles. The first gray rectangle says Accreditation Guidelines. That is the place to go. This is a vitally important spot on the website. Now, let me also just say, the version of the guidelines currently on the website is not the most up-to-date. We've been working with the website developer to come up with a new navigation system. So I will send you a PDF version of the most up-to-date guidelines after the webinar. Okay? The problem is when you get a PDF of something like that, it no longer is dynamically updated, right? However, again, I'll send it to you so you have the most up-to-date. There's some new information in there, and we're hoping that very soon that will appear and that will be populated into the website. Now, COA's process is designed to give you several opportunities to show COA that you have implemented the standards. The primary one is in the center, is the site visit, right, where a team of professionals is going to come onto your site and walk around and evaluate you. The first major opportunity, however, comes about 10 weeks before, 8 to 10 weeks. It's the self-study. Without going into too much detail, if you don't know, the self-study is a large number of documents, policies and procedures, and a variety of other kinds of documents, as well as some narrative responses to questions about each section that are submitted before the site visit, and that gives the peer reviewers the opportunity to start to get to know who you are before they arrive on site. So you submit your self-study. 8 to 10 weeks later, you have your site visit, and then after the site visit, if you have anything you still need to remediate before you can get accredited, you'll have another 2 to 3 months to come up with a response before you go to the, before your decision-making process is finalized. Now, so keep that in mind. There's no one place where this is a make or break, process. We are working with you, and our goal is to get you accredited. Okay, this is not a regulatory visit by the state where we're looking for problems, and as soon as we find something, it's you get written up or something. So you have 3 primary opportunities. For those of you who are re-entering this process after several years, we now have something called a preliminary self-study, which we'll talk about in a little while. And on the far end, you see on the right, you see where it says deferral. That means if once you send in your response to your site visit report, if our decision-making body still thinks you need to do more before you can get accredited, they'll defer the accreditation decision pending receipt of additional information. So just so just so I can fill out the explanation of this page. So again, the takeaway here is you have multiple opportunities to show us that you've met the standards. Any questions about that? Or anything so far? Let me also verify. Somebody has said to me that when I opened up the website, it didn't open for them. So if anyone else had a problem with that, let me know. Obviously, if that's going to be a problem, I won't go to the website again. Okay, I'll continue. I talked to the COA, your accreditation coordinators here about a year ago because I wanted to develop a slide like this and asked them what would they advise their agencies about going through the process. And the biggest response was they felt that agencies did not contact them enough. They were getting a lot of there's a pretty good percentage of organizations who get pretty far into the process and never have contacted the coordinator to ask them questions. So don't hesitate. If you have a question, ask it, okay? If you do have questions, the best way to ask it preliminarily right up front is to email them to the coordinator. That's often the case, or sometimes the case at least, that they'll need to get more information to answer it, especially if it's about a standards question. And sometimes it's not, there's so many standards. Sometimes they get questions every day that may be somewhat unique. So they'll often need to go and consult with other coordinators or with the standards department. So emailing is better than cold calling. And then they'll follow up with answers. You're also encouraged to file a case, okay, which is basically a form that you can ask any number of questions about. I'm not going to go through the process of that. If you're already in process, there's a way to do that through your portal. And if you have any questions about that, talk to your coordinator about how to do that. Okay. Creating a work plan. We have available to you in the tools and resources area a work plan templates, and here is a page from it. And in fact, what we're going to do for the next fair amount of time in this training is go through the work plan and use the work plan template as the launching point for discussion. Okay. Whether you use the template, you have something you create yourself, the things that are most important is including all the significant tasks, milestones, etc., that are going to be part of the process. Now, this template is very bare bones, and so many organizations who use it find themselves really expanding on it. Okay, it's a Word document, so you can add columns, add rows to your heart's content. And this is for you. This is not anything that gets submitted to COA. Just something to guide you through the process. Okay. You want to be thinking about assigning responsibility and giving people due dates. And even if you haven't really entered the accreditation self-study phase of this process yet, or if you are on the verge of applying or reapplying, I think you already want to start thinking about who's going to do what. Okay. Stephanie, just give me a minute or two, then I'll get to your question. The work plan template is 5 parts. Today, we're going to talk about the preparation and the self-study parts of that document. Okay, this is really what we're talking about today. And I do want to ask, hang on a second before I'll go that. Are any of you using this template? You can do the yes or no. You can answer it in the, just want to know if you're using it. Nobody's using it. If you are in process, okay, and I know most of you must be, and you're not using it, why is that? Roshni says she's using it but modified it, which is good. That's what is supposed to happen. And I wonder if Patricia says not yet, but let me know. I mean, if you're not using it, is because you've got something else you're using. Okay. I mean, there's a variety of reasons. Great. And obviously, Microsoft Project is a great piece of software if you have it to help with this process. Just wondering, and even if you're not using it, I would consider, and you probably have already done this, looking at the template at least and seeing what we have put on there as really significant milestones, and making sure that that whatever document tool you're using does reflect what we as COA think are the major things that need to be addressed. Okay. Now, here's where you can find it. This is how you get it. One way to do it, let me just put this away for a second, is to go into the accreditation guidelines, and within the guidelines, there is a link to the document. Okay? So this is from the public site. You don't need a portal account. It's right there in the public guidelines. Okay? Another way to do it is to find it in the tools search. So you go to training and resources on the top of the public site. When that opens up, go to the bottom, type in Accreditation Workplan template, and then what comes up is various versions of the template. So the third one down is what most of you are likely to be using, right? It says Accreditation Workplan template, private, public, Canadian network. Something I just discovered, I didn't know this was available. Do you see the 4th entry here, creating an accreditation work plan, the bottom one, that is actually a recorded version of this training that I did. I'm not sure when the recording is from. It may be a little outdated, but there is a recorded version of one of my Getting Organized webinars available, and by clicking on that link, it'll actually take you there. It's on our YouTube page. But just as an aside, I did not know that you could get that directly through this tool search. So anyway, the primary way to get it would be that link through either the guidelines or doing a tool search here. All right, let's get a little bit. Let's start to really look at the template now, and look at the process. First thing I want to do, however, is remind you of the significant milestones in this process. Basically, in a nutshell, once you really begin this process, once you sign your accreditation agreement, you can expect your site visit to be approximately a year later, okay? Now, within a couple of weeks of formally signing your agreement, you'll have an intake call with Rebecca Tedesco, who's our intake specialist, and she'll go through a variety of questions, and you'll be talking about your programs, and then you'll be talking about which service sections will apply to those. There's a variety of things that happen in that intake call, and it's very, very important. 2 weeks after the intake call, you'll have what's called the transfer call. This is where you have your first conversation with the person who's going to be assigned to be your accreditation coordinator here. After that, pretty much this is where you are doing the work of getting accredited, right? Doing all the assessing of your practices, comparing standards against your own policies and procedures, all of that work, which is really the work of getting accredited, will begin in earnest. Now, I wanted to point out a couple of things. We've recently updated and modified some of the time frames, okay? So you'll see here, the next entry is there are two things that are due approximately 4 months before your site visit. One is the submission of your preliminary self-study. We'll talk about that in a little bit. And also that is going to be the milestone by which you want to have your stakeholder surveys sent. Okay, and that's a difference. There's a difference that self-study, preliminary self-study is a very new thing, so that's newly added to this. And the stakeholder survey time frame was 6 months, and now they've moved it to 4. So I just wanted to point that out in case you're using any of the older material. That has very recently been modified. Then approximately 8 weeks before the site visit, your self-study evidence will be due. And then once that's done, an extremely important milestone is going to occur, which is your call with the team leader of the group that's going to come on site and review your site. Very, very important. A lot of really critical details get discussed in that call, not to mention the fact that you're introduced to the team leader. From that point forward until the site visit, your primary contact will be the team leader. Okay? Throughout the process and beyond, you still have contact that if you want it, with your COA coordinator. But for that period of time between the team leader call and the site visit, your primary contact becomes the team leader. And then, of course, you have your site visit. If you have any questions about anything on this slide, let me know, or anything about the time frames. Okay? Now, following your intake call, really important that you verify what was agreed to in that call. Okay? There's something we used to call your accreditation plan, which we still call it here sort of informally in quotes. We'll talk about it in a moment. That used to be sent in the mail. Now it's uploaded into your portal. And Additionally, it includes a list of all your programs and which specific service standards that was assigned to those. So really, really important that you verify that. One of the first things you should do is make sure the date you thought you agreed to for your site visit, for your self-study due date, all of those dates are what you thought they were, and all the programs that you have and what you assumed with those assigned service sections were actually entered. Sometimes there are mistakes. It doesn't happen that often, but again, critically important that you do verify that. So as I said, they are uploaded into your portal now. Once you have a portal account and you log in, one of the things that you see at the top of the page is called your MyCOA dashboard. Okay, below that, the first entry is these 3 sets of documents. The assessment table is the one you definitely want to check. This is where your services and programs are connected, okay, with the standards. So check that. That's the document. We'll talk about the other 2 documents a little further along. And also on the website, there should be information below this about other significant milestones. So you want to check those and verify that those are accurate. Yeah, April, yeah, the coordinator is with you throughout. And if you have questions for him or her, whatever part of the process, you can ask. I mean, primarily they'll be working with you at the beginning up until the team leader, up until you submit your self-study evidence. And then the team leader will be your contact up until after that, until the site visit. After that, there's still going to be a fair amount of time that you'll be working still and responding to the site visit report, et cetera. At that point, you can contact your COA coordinator. Now, for the portal accounts, when you enter the process and basically are ready to fill out your application, you go over to Client Services, they'll give you the portal account. And from that point forward, you'll be able to get into the portal. This is not going to be a portal training. I can't go into much of the details, but I will talk a little bit about the portal coming up. Now, next entry is forming an accreditation committee. Question, yes or no, do you have an accreditation committee? And let me just say, if you're not in this process yet or you're getting reaccredited and you haven't got to the point of doing that but intend to, then you can answer yes. Okay, it looks like we still have a few not answers, but for the most part you have. And I'm assuming if you're answering no, I'm hoping that you haven't got there yet. Unless you're a really small organization, this really has to be a team effort. And one of the first things organizations do is pull together if they're going to be able to an accreditation committee. The role of this committee is to help you manage this process, right? You can see a typical committee. I mean, you're being the primary contact here. A typical committee is going to include some senior staff. If you've got multiple programs, you may have program directors or somebody representing the programs, as well as other staff, maybe a quality improvement director or other staff who are interested and have volunteered to help oversee this process. There's a lot of work that's going to have to be done by staff. You might not be the person to know who's the best person to review the RPM standards or the HR standards, whatever. Hopefully, some of the people who are going to be senior enough to do those reviews are going to be on this committee. But you're going to need this group to help you figure out who should do what and help manage that part of the process too. Again, as I said earlier, I don't know where you are in the org chart and what level you are, but there are board chairs are going to have to do work, CEOs are going to have work to do, CFOs, So, and someone's going to need to keep everybody on point and on task. So it's good to have some decision makers, right, or some senior staff on this committee to help emphasize the point that may be needed. We got to get this done. We have a deadline. Please send in your draft, right? Those kinds of things. So, and this generally help organize and manage. You know, there may be resource issues beyond assigning staff, and maybe you need to, maybe the best thing you need to do is, you know, you're going to need a bunch of late nights, and so you want to order pizza. Now, I'm assuming you won't necessarily be the person who can authorize that. But again, resources come in a variety of there's a variety of type of resources. So again, I think it's really important to have a committee, and also it gets a lot more people involved with understanding what is going to happen, what has to happen to get your organization accredited. Next step, I think, once you've begun to think about your committee, is to really review the standards, familiarize yourself with the website, get into the portal, learn what's going on inside of the portal and how to use the various things, look at the guidelines and tools, right? And the committee members should also do that. Okay, we have some resources that are helpful. We have a self-paced training that's an overview of COA accreditation. There's also a self-paced training that we recently posted called Getting Started, and we're going to talk, some of the content of that Getting Started self-paced training was pulled from this webinar, but I think that would be a good thing for all of the people on your committee, and anyone actually is going to be deeply involved in the process to review those self-paced trainings. Now, for those of you who don't know, most of you know by now, we have this new website, and coanet.org. Most of the resources, the trainings, the standards, the tools can be accessed through the website, okay? You, as the primary contact, and a handful of your staff are going to be able to work inside of your portal. Now, we'll talk about who gets access to the portal coming up, but there's there may be some good reasons to not let everybody in your organization have access to the portal. And it may be that one of the best, for general use, your staff can access the standards and all the other major resources through the public website. Okay? So you want to familiarize yourself both with this website and with the functionality of the portal. So here's basically, once you click on the standards and open up one of the standards, sections of standards, in this case we're looking at the standards for public agencies, you can start to see the basic organization. You can see under the bottom arrow, this is where the guidelines are found. And that is a multi-page website. Here is here's the sort of table of contents of the guidelines. I know if you haven't seen this, there's a lot to look at. But the place to look for what we're talking about today, I've highlighted it: planning, organizing, conducting the work. Some of the ideas, some of the major ideas and concepts from today's training, I put into that section. It's a little mini version, but that's a place definitely you want to take a look at. But overall, you, who's, again, responsible for this whole process for your organization, really should read all of this and really understand what's in the guidelines. Now, we have a tools search function, okay? And to get there, go to the training and resources drop-down menu, and then the fourth entry down is tool search. The interface with the tools is a lot, how should I say this? More user-friendly than getting access to the tools from inside the portal. Okay. Additionally, all staff have access to the tool search through the public site. Now, I don't know if you have looked at the public tool search recently. It has been redesigned in the past couple of weeks, and frankly, I don't think it's nearly as user-friendly as it was. Basically, let's go to the next slide. And this is the same as before, but things have changed a bit. You have filters on the side once you open this page up. So if you're a Canadian organization, you can click under Program Canadian, and then it'll filter out all the tools that, only the Canadian tools will come up. But as you can see, under the new way they've designed this, there's a vast number of documents available, many of which are going to have no interest to you whatsoever. So the best way to search for something is under 2, use the search terms. So if you want to see what's available, say under human resources or training, type one of those terms into the tool search, then hit search. I'm not sure. We're going to eventually, and I think hopefully soon, inside your portal accounts, have a more of a browsable list of recommended tools, but there is no way to do that right now. So you sort of have to know what you're looking for in order to go find it. So what I'm actually going to do in the meantime is another thing I'm going to send you after this is over, this webinar. I'll try to do it tonight or no later than tomorrow. I'm going to send you my list of recommended tools, okay, so that you might not know, for example, that there's a document of training worksheet that covered all the different, all the standards where COA wants staff to be trained on something. In the management and service delivery administration standards is a tool that lists all those places and gives you columns to write staff names in, and you can track for yourself who got what training. Now, if you don't know that exists, at this point, it's going to be really, really hard to find. So until that part of your portal accounts is populated with information, I'm going to make this document and I'll send it out to you. So you'll at least have something to start with. Does that make sense? Are you following? Is this good so far? Are we together here? I know I'm talking a lot, and I don't know if you've tried the tool search and been successful, or have had some difficulty with the user interface. But I would recommend you try it. And if you're having some difficulties, let us know. I'm still going to be working soon on sort of a how to use the thing document, but the new format is fairly new at this point, and we're wanting to see what kind of comments we're getting from people. Okay. All right, so let's move on. These are some of the really important documents that I think you as the coordinator and for your agency, the primary contact, should have on hand. Now, whether you want to print things out in hard copy or, I don't know, however you want to do it, have a folder or just make links, I think once you get into this process, you want to have whatever work plan you're using readily available. If you're using a tracking sheet to track progress on individual standards, you want to have that readily available, and I'll talk about that in a little bit. The documents in your accreditation plan, and I think primarily this is the service assignments. You probably, at this point, once you're in your portal, you don't need to have that in hard copy, unless, of course, you don't want to look at the computer all the time. And you like looking at things in hard copy. Just to save your eyes, you may want to print that out. You might want to have a hard copy of the guidelines too. Again, someplace you can take notes, or again, just read when you don't want to look at your computer screen. So that's another document I think you want to have. The accreditation policies and procedures. That's sort of the rules of the road, and this is everything about accreditation you might possibly want to know in sort of technical, legalistic, whatever, regulatory type language, part of the contract, really explains your rights and responsibilities and officially what's going to happen. It's a relatively lengthy document, and you can't read it online. So if you've never seen this, I urge you to print this out. It's not the most gripping read in the world, okay? But there's a lot of things you really should know about the process in this document, and not the least of which is a very detailed discussion of the decision-making process and all the different types of accreditation outcomes that are possible, okay? So a vital document, which I think is pretty much overlooked by a lot of people. Next, I would make sure that you get a copy and look at the rating indicators and understand those. Those are that's the rating scale that the peers use when they're assigning ratings. And also, many people don't realize there are special rating indicators for the PQI standards. Okay, and you need to know those. You need to know what's on those. So a few things that I think that these are all vitally important documents that are that you really should have familiarity with. Any questions? I'm just going to take a moment and take a sip of water. I'll be right back. Okay, getting started. Many organizations have an official kickoff event when they get going, right? They have a staff meeting, all-staff meeting. The CEO makes a speech. They might introduce you as a primary contact. The board chair will come down often and say something about why we're doing this. You want to get everybody on the same page, right? You want all staff to understand that basically this is really important to your organization. And you want to explain why you're doing it, what benefits are expected to accrue to your organization, why it matters to your organization. Talk about the importance of it for your image in the community also, whatever the reasons are. Introduce this whole process to your staff. And from that point forward, you're going to want to keep it on everybody's mind until you get up to the site visit. Not everyone is going to be deeply involved in this process. Not everybody is going to be looking at standards, obviously, but make this something that the whole organization is aware of and is involved in, okay? And at some point, you need to start to talk to staff and help them understand that they're going to be involved in what their role is going to be. Maybe the big kickoff event isn't the place, but maybe it is. Maybe if you're going to organize everybody into various teams, maybe this is the time you've already figured this out. This is the time to put up a chart about how the standards, how things are going to be broken down, who's going to do what. However, but I think organizations tell us it's a really good way to start and get official kickoff and really get things rolling and have it be on everybody's mind. Now, you do have to, whether you do this before the event or after the event, you really have to get serious about staff resources, who is going to do what, okay? How are you going to assign standard sections out? How is that going to be overseen? You can see in the work plan template, you can assign who's responsible in the columns. You can talk about, you can put in here what exactly is deliverable and what the time frames are. Now, this is the big picture, right? The big picture work plan. This isn't really going to help you with, all the different standards if you're looking at, all the documents in the self-study. For that, you're going to need some other tools to help you with, and we will discuss some options in a few moments. But the earlier as you can really begin to think about who's available and who's going to need to do what, and who's going to be available to do what tasks. Now, you want to start to prepare and orient your staff to the process. Now, this can also be done at the kickoff event. We used to give a PowerPoint presentation, a template out that I had developed with basically that you could download and use to prepare your staff and to train your staff and give them an overview. We now have a video. You've probably seen it, the Introduction to COA Accreditation video, which covers much of the content that used to be in this downloadable PowerPoint presentation. So what organizations are doing, many of them, is playing that 20-minute video at their kickoff event. Now, maybe you don't want to do that. You can take the outline of some of that basic information to discuss it. But I think it's a really good tool. And maybe this is this kind of thing when you break up into groups, or each department will have their next meeting. You'll all look at the video. Everybody should understand the basics of what this is about. Okay, and I think the video is a really great tool. Now, one of the questions I had, one agency contacted me because the way this video plays is streams through the internet, and they had some difficulty with, I don't know if maybe it was either the firewall or something to do with their browser. So we created actually a single video of it, which we can send you that on a disk. It's not really downloadable because it's like 50 megabytes. It's a huge thing as a single file. But Patricia, there's a link, and there's a link. What you need to do is you go into the training calendar under resources, right, under tools and resources. And one of the first things you'll see there on the top is Introduction to COA Accreditation, and it says self-paced training. So you go through the process of registering for that, click on it, and then what it is a streaming, it'll play through your browser, basically. Okay? And then, whoever's watching it, and you can have multiple people watch it. You can, again, multiple people can register to look at it. So it's accessed through the training calendar, and it's called self-paced training. Okay. Take a look. If you're having any problems, let me know in an email, and then I'll walk you through it. And if for some reason you can't play it streaming, it's possible to burn it onto a disk and mail it to you. Obviously, that's a little labor-intensive, but that is an option that is available, okay? So check it out. Has anybody, let's do a little bit of interaction here because everyone's probably getting bored of my voice. Yes or no? Have you seen this video? And if you have, maybe, put a comment whether it was helpful or not. Wow. Only one person has actually seen it. Okay, again, if anyone has any difficulty with accessing it or finding it, send me an email. You all have emails from me with resources and things, so let me know if there's a problem with that. It's a little, I'm not really sure why we make it so hard to find, but again, it should be right near the top on the training calendar. And that is something, again, I think is really useful for showing your staff. Okay. We've talked about evaluating available resources, right? Time comes where you really have to start then assigning staff to different tasks. There's a couple of things to think about. And obviously there is who's responsible for what, right? So you have an HR department, maybe. You have an HR director, and it makes perfect sense to give that person responsibility for looking at the HR standards, looking at the evidence, and doing whatever evaluation is needed to see if you meet the standards, and then making recommendations as to what still needs to be done in order for your organization to meet the standards. You, however, may have people that you don't realize have expertise in HR that could also contribute to this effort. We have a person here who works in volunteer services who used to be HR director at a company, and she retired, but now she's come back for a second career. Who knows? I didn't know until recently that she has a huge amount of expertise in human resources management. So one of the things you might want to be thinking about is not just the obvious, but if you know your staff, there may be people who've got expertise that's not currently related to their job responsibilities, but that from past jobs could really be helpful. Another thing, however, and this comes into line with professional development possibilities, are there people who would be interested in being involved? Do you have staff who are looking forward to a career in human resources management? Maybe they're in college, maybe they're going to get some education, who would love to have the opportunity to roll up their sleeves and get involved with this issue. So don't overlook the potential here. I know it's a little more work sometimes to dig deeper and find out who's got what, who might be interested in what, but the more people that get involved, the better this is going to be, and the more people who are involved in the accreditation process, it's going to be a richer experience for your organization. In the end, what you're going to be evaluated against is, have you implemented the standards? Have the standards become part of how you do business on a day-to-day basis? And the more staff who are involved in getting you there, the easier that's going to be, I think. Rather than, say, have one person do this, and all of a sudden you've got so much work to do to get everybody on board after the fact, right? So, again, this is something to think about. Yeah, Anne Marie, I know that is there was some utility to that, and it's been sort of a question whether it would be helpful to actually create that PowerPoint. At this point, I could probably just take screenshots from the documentation I created to make the self-paced training. If you really think having a PowerPoint really would be helpful, then I'll put that back on the list. So, okay, I made a note of that, Anne. All right, so we talked about now, we're thinking about you're assigning people, you've got teams, okay, and you're getting them prepared. Now, some other preliminary things to do. Well, actually, let me just pull this back. This is still part of this. Here's your accreditation committee, right? There's a couple of different ways that organizations, there's many different ways you can organize your teams. What I'm going to give you is a couple of ways that other organizations have used, but by no means is this in any way the way to do it. So what we have here are teams related to the management and the service delivery administration sections, okay? So some possible way to organize this, right? Risk management in this case is a team, and that's coupled with the administrative and service environment standards. That's a logical connection there, right? Because most of what's in, when you're managing facilities and managing the environment, that's really a risk management exercise. And just to tell you, when the first draft of the standards for the 8th edition, and this is something I was working on, the risk management and the RPM and ASC standards were together in a single section. So some other ones, HR and training, right? Customer rights and ethical practices. There's no right or wrong way to do this, but just to give you a visual to maybe get the gears turning if you haven't really thought about this. And then you can add program-related teams, right? In this hypothetical organization, as you can see, they have adult services that they provide, and there's a number of COA service sections that apply to different types of programs. They also have outpatient mental health, and they have crisis response services. So, again, teams, that you can create potentially about each of these. And again, this is about sitting down, looking at the standards, compare them with your practices, and making a judgment as to whether your organization meets the standards or not. And then you have to, again, figure out what are you going to do about it if you don't. I think interns can be helpful. It really depends on skill level. I mean, not everyone who's an intern will be advanced enough, I don't think, to look at your conflict of interest policy and procedure and tell you if it really meets the standards or not. But maybe they could. There is some part of this assessing practices, and this will be covered tomorrow in the Assessing Practices webinar, that's clerical, right? There's an actual going through your manual and looking at the table of evidence and saying, we have a conflict of interest procedure, we don't. We have a nepotism procedure, we don't. COA wants us to have 2/4 of PQI data. Do we have it? We don't. So there's that level of review. The next level, obviously, being, do you meet the standards, whether you have the document or not? So I think there's a value in it. And I don't know if any of the others of you who are on are using interns. And if you're using interns, and let us know, let Patricia know in the chat box how you're using them. If you have some interesting way to use them, or just any thoughts you might have on teams and who goes on the teams. So here's one model, okay? And then different models, slightly different, I don't know. Here's another way to look at it. This one adds quality improvement. And I guess it's somewhat similar, but I think what you want to do, I mean, unless you're really small, but create a chart like this, or the prior one, and really think about, again, who goes in there, who's doing what, and what their responsibilities are, and then present that. Make this part of, if you've already done this, make this part of your kickoff event. Make this part of your orienting your staff to how this is going to work. Just some thoughts. All right. Here's a big question. Are you using the MyCOA portal yet? Now, those of you who have been through accreditation before know that we had MyCOA. We had a MyCOA portal before, but it was a completely different thing. So it's not a new concept, the portal, but obviously with the new website, it's pretty it's a pretty changed place to be. I mean, it really has a lot of functionality that it didn't have before. So it looks like we have a little more than half who are using it. We have 7 no answers. So I'm just going to give you a little bit of information. And again, we're not going to go deeply into this, but first thing is, when you start this process, you're giving 3 licenses, basically, 3 logins for 3 staff to get into the portal. The portal gives you, if you don't know, a custom version of the standards. So, for example, if all you do is case management and outpatient mental health, log into the portal, and those are the only 2 sections of standards that you'll have to look at. Okay, all the other 48 sections of standards will not be, you don't have to worry about them. They won't be there. The other big advantage of the portal is, rather than creating a self-study and putting it on a jump drive or on a CD and sending it to COA, you'll be able to directly upload evidence into your portal. And at that point, when everything is uploaded and you've submitted it, then the peers log in and they get to see all of your documentation and your narratives, et cetera. So that is the real savings. Now, there's some sort of a perception, or maybe it's a marketing perception, I don't know, that using the portal for this is a huge time saver. And frankly, it's not, okay? You still got to do the work. But what it does do is it makes it easy to upload the documents, Okay, so when the time comes to upload it, you still have to create the documents, organize the documents in the same way you ever did, but you don't have to create a CD or a jump drive, and you don't have to use that crazy table of contents form that we're using. So there is some work savings there, okay? Now, if you're not going to purchase more licenses, I said you get 3 for free. If you want additional people into the portal, you've got to buy licenses for them. I mean, and that is, they're not super expensive, but if you're not going to purchase more licenses, staff can easily access the standards and the tools and other things through the public website. Now, there's some idiosyncrasies, or maybe not idiosyncrasies, but some people think there's good reasons not to let everybody and their brother into the portal. Once you start uploading evidence, if it's not done correctly, some serious mistakes can happen, right? So what happens if I upload a procedure for a standard, I think it's done, and that's done like like a month ago, then you come along and upload a document. The document I uploaded is erased, and we've had some people with problems where documents that were actually the final version were being erased by earlier drafts. And so what I'm trying to say is have a really good system for organizing your documents, and in the end, it's probably better let people work on their drafts, but limit the number of people who can actually do the uploading and those kinds of tasks. If you have any questions, talk to your coordinators. This is fairly new, and there's a variety of experiences that are being reported. But I think being conservative about who gets in there, I think, is better. And once you get in there, you can easily. I think you can do that. They were going to put this in there, but you should be able to still print out the standards. You can certainly print out the standards, PDFs of the standards from the public website. Okay. So we also, as you probably gathered, recommend that you don't create your self-study in the portal. Okay, don't store drafts in the portal. Don't write your narratives in the text boxes in the portal. We recommend that you do that outside, and when things are done, when you know things are final, only then do you upload things. Now, what I'm going to give you next, actually let's go to the next slide first. Recommended, as I mentioned already, setting up a file system for maintaining drafts and even narratives, okay? Now, you might not know this, but operations, which is the department the accreditation coordinators are in, have created a tool for drafting your narratives. Basically, it's one long document with every section of standards, and under each section of standards is all the narrative questions in a Word document. So you can work on your narrative drafts there, and then when you're ready, you copy and paste right into your portal, and then you're done. Again, rather than writing in there and risking somebody else coming in, and I really do think that is the practice we've been trying to promote. Okay, so creating this document outside of the portal, and what I'm going to give you now is I'm going to give you a file structure recommendation. You're probably already beyond this, many of you, but if you haven't started this yet, and this is brand new to you, just think about this. There's a lot of different ways to do this, but for first thing, create a folder for each section of standards. So here we have Administration and Service Environment folder, Adult Day Services folder. These are all the sections of standards that apply. Create, for each section of standards, create a subfolder for each of the core concept sections. Then create subfolders for the narratives, for your on-site documents, as well as your self-study documents. If you take the training tomorrow, you're going to know that one of my points is that when you're going through the self-study process and you're evaluating your practices, don't distinguish between what is a self-study, standard, and evidence, or on-site evidence. Once you're looking at HR3, you don't want to have to go back in 4 months and revisit it to see what's up with those on-site documents. Okay, do it all at once. Do the assessment and the evaluation all at once. So you've created subfolders, and then looking at the documents listed in the tables of evidence, create a folder for each of the individual documents, whether it's a policy or procedure, on background checks, or whatever. And then finally, a drafts folder and a final folder. And when you have things in the final folders, that's where, from that folder, I think that's where you want to upload. Now, I don't know if it's possible or advisable. What I would probably do is that final folder in everyone, I would put a passcode lock on there, so nobody can put things in there but me, and certainly no one can change anything once it goes into final. So nobody's, somebody's, you don't want someone messing things up without you knowing it or getting in there. So anyway, this is just one possible way to organize this, but something to think about, right? Okay, next. Setting up a system to track progress on individual standards. The big work of the accreditation process, as I said, is the assessing of your practices against the standards. You want to be systematic about this. There are a lot of standards. There are hundreds of standards, really, for most of you. If you've got more than a couple of services, you're definitely into the hundreds. Okay? Every standard has evidence. Not every standard has evidence. Not every standard has documentary evidence. You're not going to have documents for everything. But there's a fair amount. So figuring out a way to track that, I think, is really important. And I don't know, some organizations track the work on Excel and create Excel spreadsheets. Sounds like somebody here is using Microsoft, I forget the title of it, not Planner, but a Microsoft work plan, something you use as a work plan. You assign individual documents to people. Create some sort of system. Some people can keep track of that on a pad or even on a hard copy of the standard. But however you do it, I think you've got to come up with this system. Now, there's a couple of ways that we help you with, ways to approach that. Before this website was done, the new website in the portal, there was a tool in the tools index called the Evidence of Implementation Worksheet. Okay? What we've done now is we've taken that and automated it. So as you can see here under My Documents part of your dashboard in the portal, everybody has this thing called the Evidence of Implementation Worksheet. When you click on that, a Evidence of Implementation Worksheet is automatically generated, which is specifically tailored to your organization and the standards that you are needing to meet. It includes, and this is, I just used this as an example, and you'll recognize this if you've looked at the old one. Most of this is the same, but it includes pretty much all the evidence that you'll need to consider. On-site evidence, self-study evidence. It lists also the interviews, who could be interviewed. If there's a special tool you have to submit, like the foster care data sheet, that's listed here. So pretty much all the evidence is here on this one sheet, with one exception, and I'll talk about that in a second. And you can use this if you want to track progress. You see, we have so for BSM-6, on-site activities, actually this probably wasn't the best example. I'll have to get another one. But say it said, case record review procedures. So somebody does their initial evaluation, we have it, yes or no, or we need it. And if we need it, who's responsible for fixing it or updating it? And then it's also not applicable. So this is a tool that organizations use. It was initially intended to be a tool for like last-minute checking. Okay, we're doing our final check or close to final check on all of our evidence. We have it, we don't have it, we still need to get it. But people have adapted it to having that broader use for tracking progress. Some people have said, though, that that's not enough detail. So we created this tool, Standards Assessment and Tracking Worksheet, which gives you a lot more detail to work with. So on the left, you can type in the standard, ETH1, ETH101. You can look at this from a core concept perspective or all the way down to the practice standards. And then you can go across, right? I assigned it to whom? Here's a due date. It's assigned to the reviewer and the comment. They can, it's the first review. You can figure out what's needed. Then there's the next level. If things still need to be done, if it needs to be fixed or created, who's going to do that? And anyway, you can see you can use a tool like this to more finely tune the progress of assessing of the evidence for individual standards. This is a Word document if you want to use it, and again, you can change anything on here, change the columns if you want to think about it differently, and it's only there. Again, it's there for your use. Have any of you used this tool? Yes or no? Again, this was developed did this a while ago in response to people wanting more detail. Well, it looks like at least one person has. And maybe that you found the evidence of implementation worksheet sufficient. Again, it may be that you've created an Excel, but in the end, I really think that some way to track in more detail progress on individual standards is the way to go. And if you're willing to say, Ann, did you find that to be helpful? Did you find this document useful? Okay. Now let's get a little deeper into the self-study process at this point, okay? So you are you've got all the preliminary activities done, you've got teams, you've got a file system, people know what they're doing, and you've got your tracking system going, right? So the assessing of practices is going on in earnest. So you've got teams looking at standards, they're giving you feedback, they're saying, yes, we meet the standard, no, we don't meet the standard, or we partly meet the standard, and they're giving you details about that, right? So then you're assigning work to people to fix the documents or whatever else needs to be done, and then you're checking on implementation. This is all part of this. This is the work of getting accredited, okay? Now here's a little side note here. If you're going through accreditation a second or third time, when you get accredited, you get something called your final accreditation report. And that's what the FAR means here in the second bullet. If you didn't meet all of the standards, there'll be recommendations on that FAR for things that you should do for those standards that you didn't pass. I would pay attention to those because the peers are going to get that FAR, and they're going to look for if you've done anything about standards that you didn't pass the last time you got accredited. Okay? So just a little hint. I would recommend that you take a look at those. Okay, so again, you're assessing levels, you're drafting your narrative, and you can see this is one of the first places I actually put a recommended time frame into the time frame column. So think about drafting the narratives early and even sending them to your coordinator or talking to them about it if you want some feedback on them. As I said earlier, there is a tool available from your coordinator, a template for drafting your narrative responses. I don't think it's a tool that is searchable. I think this is something you have to ask them for, and then they'll send it to you. And again, I think it's really, really important. I think it's the best way to go is to draft this stuff as I said, outside the portal. But anyway, draft them, and if you want feedback, feel free to ask your coordinator about them. Now, this part of the process is going to take multiple, many months. In some organizations, maybe a year in the self-study process. Keep your staff updated, and I would at least do something monthly, okay? And there are a variety of ways to do it. You probably can, without even me talking about them, come up with your own. These are probably all fairly obvious. But, meeting regularly, making sure that in every department, when they have, if they're having a regular meeting, a monthly meeting or whatever, that accreditation is on the agenda. Maybe you'll be going to those meetings and giving people an update. Alternatively, you'll be giving program directors or supervisors information they can talk about, but keep people up to date. One organization I know told me that they have in their, I don't know if it was the lobby or someplace where all the staff eventually are going to go, they have like a giant fundraising thermometer. And the top of the thermometer is site visit. And so what they do is they have milestones, and as they get closer and closer, that red bar goes up and up and up to give everybody a visual, sense of where they are, where you are in the accreditation process. That sort of seemed like a fun thing to do. You can have a newsletter, you can have an accreditation newsletter, you can have emails around, however, but just find a way to do that, okay? Also, there's a lot of implementation that's going to be going on. I can virtually guarantee you that you're not going to meet all the standards the first time through. And the first time you assess it, your result of that assessment is not going to be, yay, there's nothing we have to do now because we meet all the standards. So not only are you going to have to update practices and documents, but staff are going to need to know about that. And come up with a schedule for updating people, about new practices. So if you've updated your conflict of interest policy and procedure, don't wait until 2 weeks before the site visit and then give everybody in the organization, 30, 40, 50 different documents that are now been updated and they need to know about. Let staff know as you go that things are being updated. And if you need training, make sure you give them the training, and whether it's a group training or, dealt with in supervision, or if it's something that happens in program by program. But something like, for example, confidentiality procedures, if you have something you've updated because of the accreditation process, that's not something that should wait very long, right? People need to know that. That's important. And some issues are going to be important enough to actually sit down and talk to people about, as opposed to being able to send them an updated document, an updated procedure, and say, read this and sign off that you are going to do it, So you got to start to think about that and where you're going to need to train staff and where not, and then plan for that to happen. And I can include that under the, keep staff informed concept. Draft all policies and procedures. I think you want to set yourself a deadline for the first drafts of things. You see the time frame I have here is pretty broad, 3 to 6 months into the self-study process. You might want to back that out from when this, the self-study is documents are due. You might even want to do them 2 levels. Self-study document drafts are done at this point. Documents that need to be updated that won't be reviewed till the team gets there, maybe a different due date, but have something in mind to have your drafts done because the draft might not be, might still need to be revised and updated. Once you start to implement something, the fact that, the process of implementing a new procedure, the process of implementing a new procedure might indicate that, well, we have to actually change this. It's not going to work the way we wrote it. But I think it's a good thing to do if you have a firm date for yourself where you want the drafts, and then you certainly, it helps prevent being caught in a big rush as these really important milestones start approaching, like, the preliminary self-study due date or the self-study documentation being due. You don't want to get caught up in a mad rush, which sometimes does happen. So set that deadline for yourself. Now, be aware, if you're not, that any policy that we're asking for in the standards, all policies have to be reviewed by your board and approved by your board, okay? Not procedures, but policies. You need to plan early for the board to meet and have an opportunity to review the policies and approve them. I don't know if your board is planning to, have a regular board meeting during the process of the self-study period, but the standards really do require your board to be active in its fiduciary responsibilities. But anyways, part of this process, make sure you've planned on this, and if the full board isn't going to meet, do what you got to do, but the executive committee of the board can step in and do a preliminary approval pending the next meeting of the full board. But remember this, if you don't know this, board approves policies. Also, there's two tools that you can find, and I'll send you links to these in my tools document I'll send you afterward. A tip sheet on how to write a procedure. There's also one on how to write a policy. So those aren't required, but they're, you might want to take a look at the formats that we've developed for those in those tools. Okay, are you aware of the preliminary self-study that is now a new part of this process? Yes or no? If you've been around COA for a while, you may have used the milestone document, the milestone timelines that we were using up until very recently. The preliminary self-study replaces the milestone timeline, okay? What this is 4 months before your site visit, there are 4 key documents, which you'll need to have drafted and sent to COA for review. The PQI plan, the strategic plan, risk review procedures, and your BSM policy, okay? We have a new document available to you called the PSS FAQs tip sheet, okay? The preliminary self-study frequently asked questions. So that should answer most of your questions about this. You want to take a look at this, okay? The PQI plan, this is in the tip sheet, FAQs, but if you have a pen, do a quick write down of this, okay? PQI plan is largely related to the standards in PQI 2. Strategic plan, Gov 602 and 603. The risk review procedures, we're looking at RPM 2, particularly 201, 202, and 203. The BSM policy is BSM 1, and I'm pretty sure I should know this specific standard is BSM 104. Okay, so these documents will be due as a 4-month milestone. Hang on, I'm going to go back ahead of the site visit. Now, these will be part of the self-study. So this is basically an early self-study submission on these 4 documents. So submit them the same way you're going to submit your self-study documents. And once you've submitted these preliminary self-study documents, they'll be in your portal as submitted, okay? If you are using the Military and Family Readiness Program accreditation standards and process, you don't have to do the preliminary self-study. Okay, but everybody else, and as I already said earlier that the Hague accreditation doesn't apply here, but the other accreditation processes do include this preliminary self-study as part of the process. The FAQ document will answer most of your questions, but if you have any questions here, I might be able to answer them, pretty quickly. But I think it's pretty straightforward. You should, as you go through this process, regularly check for standards updates. You know I'm sure at this point, that you don't have to meet any update to any standard that was updated after you started the process. Okay, once you sign the accreditation agreement, you are agreeing to meet the standards that were in effect at that moment. However, the vast majority of the standards updates provide relief in some way, shape, or form, whether that's a new designation that something might be not applicable, there could be a new interpretation that matches your program or your organization that would be helpful to you. We might, based on feedback from organizations, have lightened up on one of the requirements. So I think it's useful to build into your work plan monthly check of the updates to see if any new updates have been issued that you want to take. Okay, just keep that in mind. Next, disseminating the stakeholder surveys. You can see on the slide in this, I have that under the timeframes in red. That's basically because I have not yet had a chance to update the work plan template. I'm going to do that today or tomorrow, but just so I wanted to make sure that the correct time frame was on here. So what we're asking for is that these stakeholder surveys, that process be ready and they're sent out to stakeholders 4 months prior to the site visit. The stakeholder surveys are a really, really important part of this accreditation process. There are entire sections of standards where there's no documentation at all required for the, that we're asking for as part of the process, but for which stakeholder surveys are one of the primary answers to stakeholder surveys is one of the primary evidence. I'll talk about a couple of examples of this tomorrow, but if you're not taking tomorrow's webinar, take a look at Gov4. Okay? If you look at Gov4, there's no self-study documents. There are no on-site documents. All you see is information listed in the interview column. What it doesn't tell you is that there are 3 different stakeholder surveys from 3 different stakeholder survey groups which asks questions specifically about the standards in Gov4. So it's really important that these surveys are completed and we get sufficient responses. Now, you can see here, again, in your MyCOA dashboard, in your portal, the 3 documents. We talked about the assessment table. The second one is your surveys. So by clicking on that link, the survey information you need will be auto-generated, and then you'll be able to have the information you need, the basic information. Also, and these are links that I took out of the guidelines. Important documents, stakeholder survey instructions and sampling guidelines, stakeholder surveys standards crosswalk. This is a document I created that takes each question on the surveys and links them back to specific standards. So by looking at that, you'll be able to see which surveys and which specific questions, for example, link back to standards in Gov4 or any other section. So I think these are really important documents. The last one on here, how to increase client participation in the stakeholder survey process. We're getting reports from agencies that they're having difficulty getting clients to respond to the surveys. This is related to the fact that we're no longer accepting hard copy responses to the surveys, right? So all the surveys that we take either have to be done over the telephone or having the person log into a website. And I guess for some programs in some places, clients don't have phones or access to the internet. So here's a tip sheet to help you think through and solve some of those issues. If you have any questions about stakeholder surveys in the process, please contact your coordinator. Now, we don't have time to really go deeply into this. Here's where the source of most of the stakeholder survey problems are. You see in the middle online, this crazy long URL here. like 90 characters. What people are doing is attempting to type these into emails as opposed to copy and pasting. So that's the way to do it. You know, copy the URL, stick it in an email that you're going to send to invite somebody to take especially if they're going to, they're inclined to take it online, rather than try to type these out. So this is the primary source. So this is the thing you want to figure out and make sure you have down, you know, well prior to the deadline of 4 months before the site visit to send these out. Okay, I would really recommend that you take some time and figure out how this is going to work well before the deadline, okay? So you're coming toward the end of this part of the process. You've got your file structure, right, and those folders that say final are filling up and narratives are done. At some point then you must upload all of that stuff into your portal. Some people will be doing it all along. Some coordinators will recommend that you work on it outside of the portal, and then when it's all done, upload it all at once. Again, that helps minimize the possibility of overwriting documents that you otherwise wouldn't want to have happen. Something you might have uploaded 4 months ago, now all of a sudden is being erased because you've uploaded something else, and maybe it's the wrong document. I don't know. But I really think doing it at once, and certainly limiting the number of people who are given the power to upload is something you want to consider. So anyway, the upload is something you want to consider. So anyway, you've uploaded it all, and then finally you hit submit, and you can submit all self-study evidence, which is the last box here. Any questions? We have one more section to do, and then we'll be done. Any thoughts so far? Now, something that we have done recently in the portal, and those of you who are working with the portal probably already know this, but up until recently, you could only upload a single document for any standard, okay, for any bit of evidence. That has now been modified, and you can upload multiple documents for any given, for any given standard. There is a tool we have, how to upload your self-study documents, that has been updated recently to reflect that, and has a whole discussion on the topic of uploading evidence for different programs that might all be being accredited under the same service section. This was a major problem until recently, until we did our modifications within the portal. So if you haven't seen that yet, or maybe you started with the portal and then you're doing all your work outside the portal and you haven't seen that we've made that modification, I would go check that out. Make sure you know how it works. So this next section is managing the work. And once again, I'm going to take a quick moment and take a sip of water. I'll be right back. Part of what managing the work involves is to the extent that you can, is knowing your organization. What kind of culture is at your organization? Is it a, people are empowered to work on their own, they do their work, and they're not bothered very much? Is it more of a culture where, there's a lot of checking on what people are doing, micromanaging? Maybe I shouldn't use the word micromanaging because it has a negative connotation. Because what I'm trying to be is neutral about what the culture is, but what I'm trying to suggest is that you need to know the culture and know how to work within it, okay? What's the decision-making process? How does that work in your organization? There's going to be a lot of new documents that have to be reviewed and approved, right? You're not going to just create a new assessment procedure for 50 outpatient mental health programs and not have somebody have to sign off on it. Okay. What's the process? Are program directors empowered to approve changes? Does everything have to go to the CEO? For all those kinds of changes need to be approved? How long does it take? If everything has to go to the CEO, can you expect a 2-week turnaround when a giant pile of stuff gets to his or her desk? Again, not a value judgment here, but knowing that and building that knowledge into your process. Knowing that you have a week to go, say, before something is due to be submitted, and if it's typically going to take 2 weeks to turn it around, you may have a problem. So again, building in your knowledge of how things work into and being prepared as you go through this process. Understanding your staff's ability to participate. How much time has been given to whom? What are their workloads? And and again, some of this won't be up to you. This is why you have an accreditation committee with program directors on it. They're going to know who can do what, and they'll be helping assign it to work. But these are important factors here. Do you pay overtime? Will that be part of this? If so, do you need to get a budget line on that? Is this something that can be done without, or does something more formal have to happen, right? Maybe the better way to do this is to get volunteers to come in and do certain work and maybe give them pizza or something. It's just, you have to think about how you're going to manage this and staff's time. It may be something to do is to, go to Linda or one of those on-site training sites and get people to take a project management or a time management training. This might be a really good opportunity if you've been thinking about this. You also want to get a sense of individual work styles. I think, at least if you, again, depending on how big you are, and maybe this is something that, heads of committees might have a better understanding for their people, but some people you're going to know that if you tell them I need this done and I need it done by Friday, it's going to be done. They're going to do it. They're going to do a great job. Nothing to worry about. Other people, you're not going to be able to have that same confidence in, right? Some people will work better if you sit them all down in a group and they're all going to work together on this thing. They're all going to spend, that 4 hours every third Thursday to do something, and the fact that they're all together is going to help them work better and more efficiently. Some will hate that environment. So if you can get to this level of really knowing individual staff work styles, it may help you manage this process. Okay. One thing that an organization primary contact told me, and this is someone who had been the primary contact for a long time and had been through a number of accreditation cycles, what he said he does very early in the self-study process, he assigns a lot of minor tasks to a lot of different people. And he starts to get a sense from that who's going to be stepping up to the plate, who's going to meet the time frames, and he can start to really get a sense of who's going to need to be leaned on, or maybe not even, maybe you're not even going to use that person, or who's going to really be dependable. So just some things to chew on and think about as far as knowing your organization and its culture and how your staff work. There are a lot of different ways to motivate staff, and it may be that there is no one-size-fits-all, and maybe you're going to use all of these. But for professionals, and just generally with staff, talking about it as a professional development opportunity for people, right? We talked about tapping into strengths and expertise and interests. Maybe building this into people's job descriptions, or maybe making it clear that advancement within this organization, you'll be expected to step up to the plate regarding the work that needs to be done for the accreditation process, okay? Sometimes talking to them about the fact that this process is going to improve our image with the community, right? That can motivate a staff. And, sometimes the pitch, this gives you an opportunity to have a say in how this organization is going to be run or run. This knowing, find different ways to motivate staff and figuring out what message is going to work for different people. Rewards and incentives are always helpful, right? I don't know if you're using them or have used them. I've heard one of the most interesting, creative ones I've heard was an organization that's way up north in snow country, and they're pretty big. They have a giant parking lot. So once a month during the self-study process, they identify someone who's really stepped up to the plate, and for that month, they get a parking spot right next to the CEO by the front door. Right, so that's real, and not only is that very helpful to them, but it's also public recognition of the fact that they stepped up to the plate. So again, different ways to think about that might be helpful. And food is everybody's favorite always. So having when if you're getting groups of people together and ordering some food is always appreciated, right? Almost done here. Important to keep things moving. Be prepared to answer the same questions over and over again. Patience is a real good characteristic, I think, for accreditation primary contacts. It's just going to happen. You're going to answer the same questions. So be prepared, and maybe you want to create some documents that address some of this, but people are going to not understand what they're being required of at first, and it may take may take talking to them a few times. Keep the process moving forward. Think 2 steps ahead whenever you can. Right? Always be anticipating the next deadline. You're going to have a lot of stuff to fix, to modify. There's going to be new things you've never done before which need to be implemented, and other procedures that have to be updated. Make sure you don't get overwhelmed with that, and keep it flowing, right? And again, as I said, if you've really created a good work plan with milestones and deadlines, and that could really help you organize and keep yourself and everybody else on track. Last slide is being aware of bottlenecks and log jams. There's a number of places that we know from experience where work gets backed up. Getting work into the pipeline refers to initially signing work to people, right? So at some point, you're looking at the standards, you've got your committees together or your community together, and you have to start going through and assigning sections. Then the fix-it queue is the next place where things can get backed up. Is now you're getting a whole bunch of feedback about what doesn't meet the standards, what is partially meets them, what we don't have at all, and that's all going to start to come in, pretty quickly once these reviews start coming in. And you need to be prepared to track that and then assign it back out to have something be done with it. So this is another place where things can get backed up. The approval queue is the other end of the fix-it pipeline, and that is now that you've got final drafts on things, who has to approve it? Is it going to the board? Does it have to go to the board or not? Again, you've already determined by now whether the program director can approve it or the CEO, but things can get backed up. The CEO's gone for 2 weeks and he has to approve, then now you're getting the inbox getting pretty tall. So being aware of these can help you eliminate or at least ameliorate the problems that could build because a lot of things are backing up. Final reviews refers to the final check on things. Reviews refers to the final check on things. I don't know if you're going to want to look at everything before it gets uploaded. Are you going to trust the HR director that they've covered the standard? You're not going to look at any of that stuff. They say you meet the standard. That's good enough for me. I don't know. You don't know how you're going to approach that. But if you're going to do final reviews of things before they get uploaded, then that's another place that things can get backed up. And then there's the self-study submission, right? This is not the case. With the portal, it's not as bad as it used to be when people were putting all these documents in binders, and there were lots of big fat binders. So that kind of logjam doesn't happen as much. But again, there comes a point where, you know, this is all due on Tuesday, and it's Monday morning, and you've really got to go through and make sure everything is up and get everything uploaded. So just some things that we've learned from agencies about where things can get backed up. I think that's all. Thanks for attending.